So over to you, Jeevant.
Okay, welcome everyone. Whoever has joined, we are pleased to welcome Akshat Seth for this NSE CBS webinar, which is going to talk about nudges in economic and financial policy and listen to Akshat's thoughts about this. So the NSE CBS webinar series has typically an academic or more, one or two academics from IIMA who are working in behavioral sciences who come in, and we then also have distinguished guests from business or policy who have kind of used these things or have gained insights about behavioral sciences in their work. And we kind of hold an open discussion about the events and kind of learnings from this, from their experiences as well as from the academics lens. And the idea is to have a nice, fruitful discussion and everybody learns something. So the way we'll do this is, so here we have today Akshat, who is the MD and CEO of HIL Limited, which is a leading player in building products segment in India. It's a company that's been existing since 1946, is what I read, and recently developed a footprint in Europe with Parador. And furthermore, Akshat has experience in great experience in the healthcare sector. And so delighted to have Akshat here. And so we'll listen to his thoughts first. I'll kind of leave the floor open for him in some time, and then maybe interrupt him with some questions and have the discussion like that. Audience members are welcome to post their questions in the chat window, and at 4:50 p.m. we will kind of take some of those questions and maybe let's see what comes out of that discussion. Without further ado, over to you, Akshat. Please feel free to introduce yourself, what behavioral sciences means to you, if you have kind of found any use for it in your work so far, and in general, anything you want to talk about. Most welcome. Over to you, Akshat.
Thank you so much, Jivanth. Am I audible? Is the line okay?
Yes.
Excellent. Thank you. And it's a privilege to be here on this platform. Thank you so much for having me join this panel. So maybe a quick introduction, and Jivanth, you did speak a little bit about my background. So academically, I'm a chemical engineer from IIT Delhi. Never worked as a chemical engineer though. I think some behavioral nudges we got at that campus, not as much from the faculty, but from your peers and your seniors, got me straight into an MBA program. And I was promised by Dr. Sai and Jivanth that this will not be held against me in this conversation. I went to IIM Calcutta. So that's where I did my MBA from. And then after campus, had almost an 11-year career with Kearney in the management consulting space, worked across a range of industries, including telecom, infrastructure, and then much of the latter years were on the energy and process industry value chain across upstream, midstream, downstream companies and chemicals company. Worked across India, in Europe, out of the London office of Kearney, and for a couple of years in Middle East out of the Dubai office. And then 9 years ago is when I joined the CK Birla group, first as the head of growth and strategy for all the portfolio companies within the group. Did that for a couple of years. And that's where we incubated the idea of a new healthcare business, which we conceptualized, incubated for a while, and then I took on the responsibility of leading that business. So we scaled up that business, ran it for 6 years. It's today a chain of hospitals. It's a chain of fertility clinics. And then there is work that we do on digital-led customer acquisition and engagement. So those are the three P&Ls within that healthcare business. I continue to be on the board of that company and spend a part of my time. But now my primary responsibility is with HIL as the MD and CEO of that company. And as Jeevant said, this is a company which has a very rich heritage. It's been in the building products space for the last 76, 77 years, and actually is a market leader in the spaces that we operate in. And about 4 years ago, we also entered the European market with an acquisition called Parador. It's one of Germany's best known flooring company and has a strong footprint across Europe. So that's a little bit about me. I think just from a personal side, I'm married. Incidentally, my wife is also from IIMA. So there's a double whammy there. And yeah. And as I was sort of collecting my thoughts for this conversation, was exchanging thoughts with her because she works a lot in the philanthropy and the nonprofit space. So there are some examples I have borrowed from her as well. But so that's maybe Jivanth, you will wait for your cue.
Yeah.
There was a section you wanted to cover and then I come in.
Yeah. So one thing I wanted to talk to you about is, what I work in is this area of behavioral economics. That's the area I specialize in. And the idea there is that, I mean, in terms of its applications, there are widespread applications in how one designs incentives, how one designs products, how one understands the customer, understands one's kind of workforce, and so on and so forth, and designs policies so that takes into account that all of these are human beings and that they will have their own kind of decision-making processes. They'll have cognitive limitations. They'll be subject to social norms. They'll be driven by monetary, non-monetary incentives. They will often not have clarity on what you intend to do with them, etc., etc. And so, given all of this, my question was: do you find any of this relevant in your operations of, say, within the healthcare sector or within the construction manufacturing sector? And which stakeholders do you feel like you should kind of use behavioral insights or behavioral thinking to kind of manage better? So yeah, just looking for insights on these lines from you.
Yeah, and I think first I have to thank you for introducing me to this concept of nudges and nudging. And in the last week, I've been trying to understand what it is, and it's an interesting concept, but it sort of is a powerful overlay on many of the things that we do in the business world. A lot of our work as any business is to solve a consumer need. And in doing that, there is a heavy element of understanding what the consumer wants and influencing them in the right manner. At the same time, the choices always remain with the consumer. So I think in many walks of our life, and while healthcare and the industry I represent now are live examples, but let me take the canvas of the entire business world and call out examples that at least stood out for me. And somewhere you asked as to how it sort of started. As a practitioner of business, I think the first thing that we learned was it is people in businesses who drive outcomes. But then the question was, why do performances go up and down? And then the nuance starts appearing. It's actually the people's behavior which drive outcome. And much of the responsibility that a lot of us as managers drive is to influence those behavior towards the outcomes that we want. And hence, for us, it's not just the consumer or the customer, it's also the internal stakeholders which are important where this concept comes into play. It's also the external stakeholders which are important. And in that construct, I've always been I've been a keen student to try and understand what are the rewards, punishments, incentives that drive a lot of these behavior. And one of the earliest things which fascinated me was just the concept of design and how design drives behavior, because early part of my professional career, there was a lot of work we did on the infrastructure side and real estate, and how architectural design drives behavior is a very interesting and powerful nudge that can be given. And the example that I love most is from Apple. And when Steve Jobs was designing this large headquarter in Cupertino, I think it's a very interesting fact that in a massive facility, and it seats more than 10,000 people, there are only 2 locations for the toilet blocks. So it's not that every floor has 3 toilet blocks and there are 10 floors. There are only 2 toilet blocks in the whole large facility. The idea was there are product teams, there are software teams which are working in their own silos. How do you make the design such that people are actually coming together? Now, just the fact that you have to take a leak and you have to download, you have to come to that space, and that is automatically driving a certain level of familiarity, collaboration, and conversations that get started there. So I thought it's a very powerful means, just how design can play a very, very strong role. Then it got me thinking, and I am not sure about the age profile of the audience here, but I grew up in a time when early 90s, there was a very powerful campaign. It was on TV. It started with 2 sets of eyes. And those were the most recognized pair of eyes in the industry. They were Aishwarya Rai's eyes. And there was this whole campaign on eye donation. Right. And after that, there were a whole series of celebrity-led campaigns on organ donation, etc. And I was looking back at numbers. Early 90s, the number of donations in the country or pledges in the country were in thousands. They were in single-digit thousands. In 2018, just the effort that went in, I think that number had crossed the 2 million mark annually in terms of pledges that are happening. And that's really, again, a great example of how a very simple nudge where you are applying some of the principles you were outlining, Jivanth, that came in. Cigarette advertising, again, a great example. I mean, the government or policymakers have 2 choices. You can do prohibition, you can ban, you can increase the taxes. That's one way of doing it. The other is the mechanism with which they use graphic images. And I think all of us who have gone to movie theaters know Mukesh very well. That's the first image you get. But very, very powerful campaign. And again, it's a nudge. It's not, the choice is still with the consumer, but they are being made aware of the consequences of tobacco consumption. So there is an element of sensitization, socialization, awareness building, and then folks are coming in. There is now a very interesting, and I think for the last many years, just the role that digital and technology is playing in this is super powerful. You and your wife, and this has happened to us, we talk about the possible holidays 6 months from now in some part of the country, and that's a WhatsApp message, and next thing you know, your Instagram feed and your Facebook feed is filled with advertisements for exactly the same location. There'll be holiday packages, there'll be travel agents, blah, blah, blah. And again, that's where those nudges are with us, almost in our drawing rooms and on our handheld devices. and those prompts are driving certain level of consumption. I think from a healthcare perspective, there are three things, and the most powerful one is I thought was the whole cycle of how India behaved during the COVID times, where in many parts of the developed world and elsewhere in the world, there were significant protests around lockdowns, curbs and restrictions that were introduced. India, I would rate, went off fairly peacefully, and it was a combination of things that worked really well. And the specific example I will call out is just the uptake of the vaccination program was outstanding. And how did it happen? It was some clever bit of nudges that were baked in. I don't know if you recall, at some point, all our caller tunes had a COVID vaccine message. It's a reminder. There was a gentle nudge that either if you have to travel, get a RT-PCR or have a vaccination certificate, right? So you are incentivizing that behavior. And many other small things, just the fact that there was a portal and an app made that whole experience much easier, and it was at your fingertips.
So maybe I can interrupt here because I had done a primary survey at that point. And I have one paper on this that actually studied the effect of introducing this caller tune kind of intervention. And what we found was that just hearing this message again and it becoming salient in the minds increased the demand for a lockdown by a significant percentage.
Yeah.
So this is like already, it's already in the minds of the people, but it just went to show that despite it being so salient in the minds, there was still scope. Like these reminders were actually keeping the demand for economically painful interventions high because they just reminded people of what we are going through. So I think this really, it was quite remarkable, the adherence to lockdowns as well as especially vaccination behavior.
Absolutely.
That's non-trivial. That's a non-trivial achievement. I mean, developed countries really struggled to convince people in some sense.
Correct.
Here, I think social norms were used, and as you said, salience was used. And it also went to show that there's something about trust in government that still exists. It's present in India, possibly more than others in other countries. I don't know, but
I mean, that's a larger debate. But I think in this particular case, the trust building nudges that were introduced helped in, at least in that period, building a certain level of trust that there is somebody who's thinking about the things and doing it ahead of the curve.
Yeah, I'm saying trust in government in this small this aspect of say healthcare, like something like that. Not in the, I don't want to get political this conversation. Right. So but if you could give some, so there are very interesting examples in healthcare as well as in product design in nudging. For example, in healthcare, one aspect of nudging is that people make errors, and one should expect that people make errors, and that you should structure complex choices. So there's an incredible data point that shows that about 1.25 lakh deaths in the US are because of wrongful medication. So, and that's in a developed country, highly literate country, right? And so I just want to pose this question to you as a healthcare expert. My experience working in the field in the villages is wherever my kids are sick or somebody is sick, the doctors there, are often, very quick to prescribe antibiotics, right? Or they do not really care about dosage, in the sense that paracetamol is supposed to be 10 to 15 mg per kg. They'll just say 5 ml for a kid, right? Or they just say, just have one tablet without even specifying the kind of weight. And this is just paracetamol, right? So one really worries about what's happening with kind of eating antibiotics or taking very strong medication, possibly without enough reason. So my question to you is, what can be done to kind of regulate or improve practices in the healthcare sector in India, which become more scientifically informed rather than kind of, what we are right now using is unfortunately mental shortcuts. And there may be huge costs to this. Do companies kind of recognize this? Would you like to see anything from the policymaker, et cetera, on these lines, if you could kind of?
I think just on this concept, see, there are two issues here, and to the problem that you are highlighting. One is, are we practicing evidence-based medicine, where there is a certain research and literature which is driving what kind of dosage and what kind of protocol to follow if there is a certain medical condition. And while these are all trained and qualified doctors, the quality of education is slightly different. Their own interpretation is slightly different. So how do you standardize it is number one. Number two, having standardized it, how do you ensure that it is complied with? Correct? And this antibiotic example reminds me of something very interesting. This was actually something that was done in the UK NHS, where they were also facing the same problem. The number of antibiotic prescriptions that were happening through the GP network was at an alarming rate. And it's just the general implications of the population developing resistance to bacterial strains, etc., was rampant. So the NHS actually ran a central campaign where they had data of the GPs, which are the top 20% GPs, which were prescribing the highest number. And it was a fairly simple letter that used to go to them. And the letter was more informational. It was not pointing out that you are doing this, but it was more informational on just the acuity of the problem, what is happening in the industry. And it was part informational, a lot data driven, a lot of statistics, and saying here are implications. And they ran this campaign for about 6 months. There was a drop, I think, in double digits in just the prescriptions that were happening. And it was not sharp pointed that, oh, you are one of those 20. These guys didn't know that they are a select group of people who are getting it. Right. But that's one way in which they ran it. The second piece, and I'm going back to that whole social norming piece you mentioned. In medical field, in general, while there are protocols, every patient to some extent is different. And there will be variations to how those protocols are applied. The problem also is that in large parts of our country, we don't measure outcomes. I'll give a very simple example, which most of us can relate to. There is this whole, in the obstetrics field, this whole debate between C-sec deliveries and normal deliveries. How do we as a hospital drive more towards normal delivery, whereas in urban areas, in private hospitals, the statistics are now very lopsided. And the simple thing to do, and it's powerful, it takes time to take root, is actually start doing peer reviews based on data, where we are saying, here is what the statistics from the Western world is throwing up. Here is the statistic from India government hospitals. Here is the statistic from private hospital. And here is, by the way, our hospital statistics. And this is how we stack up. And just the fact that it's being done in a forum where peers are there and the numbers are being discussed month after month itself drives a behavior where the extra effort, and especially on cases which are borderline, where you could give the woman a little more chance for normal delivery, it just improves tremendously. So this whole social norming and trying to do these peer comparison and that old maxim of what gets measured gets delivered comes into play very effectively in the healthcare space.
Yeah, actually, again, sorry to interrupt you, but this actually ties to the giving feedback part of nudges. That's the G in the nudges. That give people feedback. It can be pointed feedback, like the one you said in OBGYN, or it can be kind of general feedback as to the prevalence of a problem. And the OBGYN case, there's excellent literature, recent literature in top management journals that shows that actually it kind of adds to what you were saying earlier, that even very well-trained doctors in the US, they fall prey to some kind of heuristics, in the sense that if the doctor had a poor outcome while doing natural delivery in the previous surgery, she may be more likely to switch to C-section in this next delivery, right? Regardless of kind of what the patient's file is like. Right? Similarly, if she had a bad outcome in the C-section, she will be kind of more likely to go to natural. So it just documented that there are these kind of heuristics being followed by very trained doctors as well. Right? And the fix to that was, again, something like you were saying, as in give feedback to people. Once they get this feedback that, oh, okay, that's what the data is showing, that we have this win, stay, lose, shift heuristic, it's called. If you win, you stay with the method. If you lose, you shift the method, regardless kind of the new outcome. So there's excellent research showing the importance of giving feedback. And another way, I don't know if this has been. If
I may interrupt, Jivanth, there's an interesting dimension to this. Who gives feedback is also very important. Okay, if I, as a manager in the hospital, gives a doctor a feedback, guess what will happen? And I don't know how many doctors are there in this audience.
Yeah,
I will tell you, it's a very colorful conversation.
Yes.
In a peer setting, it's a different conversation.
That's a great point.
There's another powerful way of doing this. You actually give the feedback tool in the hands of the patients.
Right.
So we as a hospital create awareness that, by the way, you as a patient should always ask a doctor, by the way, what is my normal chances for normal delivery versus C-sec? What is your statistic of normal versus C-sec? The more we make that conversation mainstream, then it's actually the key stakeholders for them, the doctors who are asking that question, and their sensitization for that is so much more. So who gives that feedback is super important.
Yes, and in fact, there's more research showing how it is given as well, in the sense that if you just kind of blame people that, look, you had a bad outcome, that actually worsens performance.
Yeah.
So they found this for surgeons, and then they kind of said that rather than kind of just say it was a good performance or bad performance, kind of go into the details, like say what could you have improved, etc., which actually then again, even though it can be a negative feedback, improves performance. But this is a great point you made.
And that's where in healthcare, the big philosophy that's always underlying everything that we do internally is a no blame culture.
Right.
Any reviews and audits are inherent to how good hospitals work and good healthcare systems work. If they become a fault-finding exercise, then it's a non-starter. That's why it has to be embedded on that principle of no blame.
Right. It's all, this healthcare discussion is really interesting. It also reminds me of this. So, I mean, there are some good examples that people have done, right? So, for example, this putting 7 placebos in preventive medicine, so sort of that prevents pregnancies, right? So I think you need to eat it 3 weeks and then you need to skip 1 week and then restart. And so the point is that if you can just make it once a day, just reduce the cognitive load on the customer, that helps them achieve the outcomes that they want to achieve.
Yeah.
And I wonder, how much that has kind of played a part in designing of prosthetics. Again, explaining to people how to use it and, what to expect, setting expectations correctly for them. I mean, it can play a huge role in designing of the products in healthcare. So do you find that kind of process happening almost naturally among the corporates or that you have kind of been?
I think it does, and the way I look at it is, at least the principle to follow when you design these programs is make the desired behavior from your consumer, your internal employees or extra easy and attractive. And for most organizations, the most important thing for employee engagement is this whole thing around reward and recognition. And you do something and you do something up to a certain level, there is almost an instant gratification, there is a recognition, and you will be surprised. It's not the monetary value of that reward, it's the social standing that they get, and the fact that they are recognized on a platform is super important. Much of our sales team, for them, the adrenaline rush comes from that reward and recognition.
Right.
And you see that at the government level as well. I think the whole design of incentive structure drives so much consumption in one direction or the other. A classic example and very relevant for our times is just these government subsidy on taxes for electric vehicle. Great example where again there is basically a nudge that you move in one direction and you are and the gratification or the incentive is right there and it's monetary.
Right. No, you're right. I mean, so I again have research on this where I found that if you sometimes actually monetary incentives can backfire, is what I found. That if you give monetary incentives, then that can kind of push out the non-monetary incentive that exists. So I found it in the realm of charitable giving.
Yeah.
So if somebody knows that I am kind of benefiting from giving charity, then I'm not so charitable anymore, because the part I was kind of most enjoying was the social recognition.
Yeah.
Right. If you take that away from me, then I don't feel like it's such a good deal anymore.
Yeah.
And that actually goes back to incentive designs within organization, as you said. Sometimes more than the monetary reward, it can be the non-monetary recognition you get.
Correct.
That can be kind of the main driver.
Correct.
So I have some of my own research on this in this domain. Excellent. So maybe I've been kind of suggested that I also talk about my own research, and please jump in if you find any of this relevant to what you've been doing.
Sure.
So I basically work in behavioral economics, and within it, to behavioral game theory. And what one big aspect of my research is that people are not very forward-looking, right? That they fail. This is something I established carefully, and then I kind of analyze game theory from that perspective. But the idea is that people fail to plan for their retirements. People fail to control their own selves, or they have to kind of take care of what they will do in the future because they have these self-control problems and so on and so forth. And the idea is that if people don't take future or understand how multi-stage interactions will pan out, then a smart person can kind of play with them and benefit from this. I mean, a good or I don't know, bad example is many of us actually end up paying credit card fines, etc. Right? Because we just we sign on to these deals which there's no fees anywhere except in that case where you are late on your payment or you overdraw, etc. Right? So oftentimes, unfortunately, companies recognize that that's a huge revenue stream and they can kind of use that to their advantage. I mean, the idea is that there one would benefit from the government coming in and saying, look, clarify, what the deal is for anyone. And, so that people don't take advantage of each other like that. I mean, one big cause of the subprime crisis was people signing on to these deals where, they didn't have to pay any of the principal in the first few payments. But then it kicked in later, but they were not thinking about this, right? So even though corporates enjoyed that for some time, eventually they themselves also suffered, right? They got to greedy with this whole game. So some of my research deals with this. Some of my other research deals with, default options and how they can be very important.
Okay.
Again, actually, this again ties some other research deals with food policy, and will looks at if you can kind of make it salient the benefits of having, say, high iron bajra in your diet, then people are willing to pay more for it. Women are especially, care for it more because anemia is a problem if you're a pregnant lady, and so on and so forth. I look at political contests, how they get biased by behavioral considerations. And then I look at, so another thing, I don't know if this is interesting to managers, is I look at mistaken beliefs about what's going to happen if you have gender-based policies for, reservation within at every level within the corporation. Right? So many companies are doing this. I don't know if you guys are doing this as well. Is that they're reserving certain percentage for women at every level, right? So what I study is the blowback from this. What I find is that people then start to underestimate people who are kind of making it to the higher levels. They have all these very negative beliefs about this operation. So I don't know if this is a challenge that you have dealt with that at all.
No, it's a challenge. It's also, I think, as an organization and as a group, there's a strong commitment for diversity, and not just gender-based diversity. It's diversity in its full glory. But then reservation at every level is one way of doing it. What we find is also at some level, the supply chain, the talent pool that we dip into also needs to be addressed before this can be done. So it's an ongoing thing. I don't think any of us have a perfect answer or solution. What we end up doing is, for every managerial position, the recruitment slate should have a minimum number of diversity candidates.
Right.
So then after that, who gets selected is basis their capability, experience, etc. But at least at the candidate slate, you can mandate that. And that's at least one start we've made. But it's something that we are conscious of, especially in a manufacturing setup, which is in far-flung places. The availability of people is also a challenge. So we'll have to address it at both ends of the spectrum.
Right. So, I get quickly bored talking about my own research. So I want to ask you one more question that, occurred to me when I saw that you work in manufacturing and design, is, how do you anticipate what kind of designs are going to be in the market? Because, one sees X type of houses and then everybody has X type of houses.
Yeah.
Right? So is it a social norm? And, how does one anticipate this? Because I guess one then has to inform one's manufacturing units, etc., as to be ready to make these new designs. Does one become a second mover, or does one kind of try to influence the market to go to a certain place? What's your thinking there?
I think I feel it has to be at any point in time a portfolio approach. You will at any point, at any given time, just from a revenue or from your effort point of view, 60-70% are things which are more momentum based and which is happening for the last few years. You continue with it. Then there are new investments and new innovations that you try, and some inevitably will fall by the wayside. Now, how do you arrive at those options? There is, of course, a lot of work that we end up doing consumer insighting and saying what are their needs and how are those preferences evolving. In the space that we are adjacent, understanding what is happening in our adjacent spaces is also important, because sometimes, in a downstream, we may be doing something, but just the paints industry is moving in a different direction, and that has implications. So how are we matching? So that's one thing to watch out for. The third thing to watch out is what are trends globally, and somewhere what may have caught on somewhere else may take a few years to come to India. And fourth, there are unique problems of the Indian landscape. So for instance, there are some conversations that we have with government ministries and government. In the last 5 to 10 years, there's been a heavy focus on affordable housing. The other topic that we are discussing is there are close to 4 million fishermen along the coast of India. A lot of these locations are cyclone prone, and it's the next focus as to what is the right type of housing for them, which can be weatherproof and yet affordable, and something that can be part of a government scheme rollout. So there is an element of solutioning that you do, and there are a few things that you will try out in that. So it'll always be a combination of these 3 or 4 things that are feeding into our innovation process, our R&D process, and new product development process.
So one last question on this, so I saw that HIL is kind of one of the leaders in green technology in construction. Now, my question is, often it's more costly to follow green processes. How does one get the value from the consumer? I mean, do you find the consumers are willing to pay this extra cost that you incur? And how does one impress and get that willingness to pay from the consumer, translating into actual payments?
So I think one, it's not necessary that it's always more expensive.
Right. Oh, that's good.
I'll give an example. The actual, so we make these blocks which are essentially crudely put replacements of bricks, the red bricks. The cost at which we make it is about a third of the red brick.
Wow.
In addition, the red brick has an eco problem because all of it is dredging from riverbeds, etc. There is a massive ecological cost to it, and so on. In fact, the supply is drying out. So it's a myth that on all occasions a greener solution is a more expensive solution. Sometimes there are ways, and that's where I think the whole product innovation bit in India is fascinating, because you have to keep the cost angle in mind whenever you are developing it. On some other occasions, and I think if the technology is powerful and there is a proposition, that's where advocacy and support from government also comes in. If you recall what happened a few years ago with LED lamps.
Yes.
It was a huge subsidization. Now nobody is buying those old technology incandescent. Yeah. So we got past that hump because there was a fairly interesting incentive structure. For the government, it was a very powerful proposition because just the per unit electricity consumption will come down, and it's cheaper to do that than to put up new power plants, right? So there will be combination, and in some cases you have to do not just advocacy with the end consumer, but also with governments to try and pull in some incentives.
Okay, got it. Fantastic.
But there's one very interesting thing I'll leave you with. I know you have to open it up for questions, but on this whole topic of nudges, the first thing that came to my mind, I'm sure there are Netflix audience here. There's a series called Black Mirror, and season 3, episode 1, it's called Nosedive. which it's essentially a system or a technology-based system where any interaction two humans have, I can rate you. And we are all rating each other at all points in time. And that rating then determines your socioeconomic status. So if you turn out well-behaved and you are a kind moderator to me, I give you 5 out of 5. That 5 out of 5 means that you can live in a certain locality, you will always have the window seat on the airplane and so on and so forth, right?
Right.
And if you keep getting pulled down in that rating, life becomes hell. What I find very powerful about that is that concept is not far. In fact, in China, I hear, and there is this whole social credit system that they are trying to bring in, which is essentially driving behaviors of people at a mass and a scale level. So the one question that I always used to ask is, why can't we have the kind of civic sense and people queuing up peacefully, not dirtying their spaces? How do you do that at a scale? One way is you put a mandate and you say there are heavy fines. But this whole piece of, if you do the social norming and there is there is a immediate gratification, is a very interesting way of doing it. It's something that projects the future for us. It's something which is very germane to this topic of nudging and how it gets assisted by technology and AI. But it's
very interesting.
Have a watch. It's an interesting 30-minute watch.
Will do. On that topic of cleanliness, of course, the interesting another case study is Delhi Metro. How is that so clean? Whereas outside it is not, and it's been clean since 2004 or whenever it started. So we have at least one question, and I'm sure Arvind will jump in at some point. So we have a question from Manish. For a country like India, which under-mentioned areas according to you would be significant to be nudged, and why? Enhancing tax compliance, digital payments, social and environmentally friendly choices, and access to social welfare programs. Well, I think all of them, are kind of important targets for nudging. Social welfare programs, often people don't know that they have access to some, and it will be nice to make it easy for people to access social welfare programs. Sustainable and environment friendly choices. We are trying all the time with, 2 dustbins showing, wet waste, dry waste, and showing kind of the impact that you are having on this area. I mean, for example, if you can somehow convince people, you can really convince people by saying bricks are cheaper if you use these new technology bricks rather than the old ones, and the sustainable as well. Promoting digital payments, I don't know, we are doing pretty well there. Tax compliance is excellent literature on social norms again. And there's literature on showing that so people often complain about where is my tax going, right? So it's where can I see it at work? So if you can do that, that's the U in nudging, that people should be understanding the mapping from a choice they made to how it benefited them. So you can do that there as well. But I agree that we have actually a nudge unit in the Niti Aayog in India now, and in several state governments as well. Where some colleagues have worked and have sort of talked to me about it, wherein the idea is that we basically try to incorporate that in policy making to get people to desirable outcomes according to people's own preferences, not just the policy makers. And on this, I just want the audience to also kind of note that nudging is also a very misused term. For example, I just saw that the RBI said that the 2,000 rupee, whole event, that was a nudge to change your notes. There was no actually, it was, there's enough time. It's not, the deadline wasn't so short, but they were like, we were nudging people. So I think that, one should take it, I would love to see it being used more, carefully it's one of those things that's become too popular on its own good, in my opinion. That, nudge will fix this and nudge will fix that. It is an incremental kind of intervention. Often it works alongside a lot of the other things one needs to fix. So on these matters as well, one would also need to fix a lot of other things and not just nudge, in my opinion. I don't know if you want to weigh in on this, Akshat, and then Arvind, please feel free to weigh in.
No, the only point I will highlight is there's a big ethical dimension to nudging. There's a big responsibility for things, and companies, corporations, governments. There is always a little bit of risk of overreach, and that's why one has to be careful. So it has to be done in a responsible manner.
Very glad to hear you say it. Very glad. Yeah. Arvind?
I'll take the opportunity to share with you 3 small examples of what I think are very classic nudges. And then if there are any other questions, we'll open it up to the audience further. So the first one was in the Bombay Suburban Railway at a crossing called the Wadala Crossing, where every year about 40 people would die crossing the tracks because they were not careful enough. So some observational research suggested that, people had lost their fear. When you and I want to cross the tracks, we will look 10 times and we'll be very, very careful even if we see a train in the distance. But these guys, because they were crossing the tracks every day, they had lost their fear. So the nudge that was put in to elevate the fear was, it turns out that the human brain is configured to feel afraid if it sees a fearful face, in a face that is afraid in front or on the periphery of the vision. So as they went towards the crossing, there were some large billboards put up with faces which were increasingly afraid. So I'm going through my usual routine of crossing the tracks, and at the periphery of my vision, I'm seeing these afraid faces, and my fear levels are elevating unconsciously. I'm not aware of it. And that makes me more careful. And then simultaneously on either side of the crossing, going out 100 meters, there are yellow lines drawn on the tracks at intervals of 20 centimeters, of 10 meters. That allows me to see that the train is actually moving quite fast. So I'm able to judge the speed more accurately. So small nudge, and it changed the behavior enough for the number of deaths per year to fall from 40 to about 8. A second one we tried at our own student mess over here, when we kind of felt that too much of food was being wasted. And so the classic one where the food which is left at the end, you're supposed to throw it in a bin and then put the empty tray into a trolley, which is then taken for washing. So when the food was put in the bin, that bin was put on a weighing scale. And a very large display showed how much you had, and just putting in that weighing scale suddenly decreased the amount. So from a policy perspective, for me, the nudges in a health space or in a manufacturing space essentially would be, for example, if I am looking to increase the use of urea, which is coated with neem, right? Now, what would be a small policy nudge which makes the farmer buy more urea coated with neem? It has an enormous disproportionate impact, because when you use urea coated with neem, it lasts a heck of a lot longer. And also, the neem itself has a beneficial effect. So the urea lasts longer through a couple of crop cycles, and the neem has some beneficial antibacterial effects which are useful for the crop. So to me, nudge is a fascinating space, because for a CEO, MD and CEO like Akshat, I would guess that a lot of his work actually gets done through small nudges that he gives on a daily basis, on a weekly basis. And you, Jivanth, of course, do your research on what kind of nudges work better in which areas. So it's a fascinating space, and as the chair of NSE CBS, it's my duty also to tell you that we encourage research. We would love to do research. So this is addressed at both you, Jeevant, and at you, Akshat, that if you want to get some stuff done through us, and to the audience as well, guys, if you out there, if you are looking at getting some work done through our center, we would be very happy to engage with you. So let me stop at that point, and if there are other questions that we have, I believe there's one more question.
Yeah, there's a question again by Manish, and he says nudges can find a way to have an impact on upstream influencers, especially politicians and political parties.
This should be answered in the context of India.
I don't know.
So I know this gentleman. So Dr. Manish, we don't really necessarily want to get into politics because that's not the job of an academic institution. Having said that, there's no reason why upstream influencing cannot take place, regardless of the area, whether it is business or politics or academia or sports. I mean, there are so many different ways of doing upstream nudges. In sports, for example, a team member can do upstream nudging for the captain or for the coach or for the administrator. If you very carefully look at the video of the match from yesterday night, Dr. Manish, you will find 2 or 3 fairly nice examples of upstream nudging. So I will leave you to discover that, and maybe we can have a conversation around those nudges.
And, I just want to add that, we discussed very well-trained doctors falling prey to certain heuristics that they don't want to. If you watch air crash investigations, Akshat brought up a TV show.
Yeah.
If you watch it, it's again and again, it's, tiny error made under immense cognitive load that causes, and it's a lack of giving clear feedback to the pilot often that causes this, and lack of expecting certain errors because a person is cognitively loaded, right? So the same thing I think applies to any decision maker, politician, manager. The idea is to give them feedback on, and so that they take precise decisions, and the less they rely on their gut, or especially for important decisions, the better it can be. So database, evidence-based decision making, it can be better. So, but of course, there's a role for gut decision making. I'm not going to say there isn't. But
so interesting you should say that, Jivanth, because I would also argue that for nudges to work, actually, if I'm designing the nudge and I want it to work on somebody else, that somebody else's the point of engagement with that somebody else is through the heuristics and biases that the person is actually subject to.
Right. That's true. But one can often one nudges oneself as well, right?
Oh yes.
So in a sense, when you set time limits on your social media usage, that's you nudging yourself, saying that, well, I will make this error, I'm sure. So I don't want to do that. So I'll kind of nudge myself.
Yeah.
So the idea is to kind of be mindful that we can often use heuristics to our own harm and try to take care there.
So I'm very mindful of the time
Yes.
that I've asked from Akshat. We're already a little bit past the time.
Yes. Thank you, Akshat.
Take this opportunity to thank Mr. Akshat Seth, MD and CEO of HIL, for joining us today and devoting this time. To Dr. Jeevant Rampal for being part of this webinar series for NSE CBS. Thank you both, gentlemen. And I hope that you will continue to engage with our center for more work, research, whatever it is that we can do for both of you. Thank you, Varuna, and your team for organizing this, and to all the audience for participating in this. If there are other questions that we have not been able to address, do send us a mail, and we'll try to get a response from both the panelists today. Thank you again very much, gentlemen, for your time.
Thank you so much for having us. Thank you.
Thank you, Arvind, and thank you all the audience. Bye-bye.
Bye.
Varuna?
Yes, sir. Just waiting. 9 attendees are leaving. Just a second.